welcome back to the Healthy Living Show. We're here with Barbara Graves. Barbara is the Director of Surgical Services at Coastal Carolina Hospital, and Barbara's going to share a little bit about what happens the day that you're coming in for your colorectal screening for your colonoscopy. So we're here in the lobby. Tell us a little bit.
So once you get here first thing in the morning after you've been told your arrival time, you'll be greeted by our registration personnel here. They will ask you to come here where you will get actually registered utilizing your insurance cards and insurance information. And once all that process is complete, we'll go ahead and progress you down to the actual surgery area.
So when people come in the morning, have they already completed their prep and now they're just ready to get started, or is there anything additional going on along that line?
No, absolutely. They should have already completed their prep prior to coming in. All those directions and information regarding your prep are discussed not only with your provider but also with your pre-admission testing nurse, who calls you typically within 3 days prior to your surgery. Again, your surgical start time is usually given the day before, so there's another phone call that's initiated before the actual procedure.
Okay, well that's good to hear. So there's a lot of communication going on a few days in advance and then the day before, so that people really feel like they know what's happening.
Absolutely. We want to make sure that the patient feels comfortable with the process. We want to make sure they feel well informed, and obviously we want to make sure that everything goes on time as expected. So now we're entering the actual same-day surgery area. Once you're escorted from the registration area by the registered nurse, she'll bring you here into one of the holding areas. I'll show you an example of this. This is our bay here, bay 1 in same day. The patient will be escorted into here and advised that we need to pretty much remove all of your clothing and get ready for the procedure. Everything is laid out here on the bed for the patient. Once you are changed and we'll get you nice and comfortable in the bed, one of the nurses will come in and begin the assessment. They will basically wrap up any information that wasn't obtained via the pre-admission testing phone call that they received. We'll also go ahead and start an IV. It's an opportunity for them to discuss with anesthesia any healthcare concerns or issues they have, and then likewise speak with the physician before we begin to roll back for the procedure itself.
So once you start to roll, loose ends are wrapped up here, that final connection with the doctor before you go in, and then we head into the endoscopy suite.
Absolutely.
Okay, could you show us the way?
Sure. So once all this is completed, we then escort the patient with the nurse anesthetist as well as the registered nurse that will attend the patient during the procedure. We actually roll you into the endoscopy suite together. Right here is the actual endoscopy suite. And from here, we begin getting the patient ready for their procedure.
All right, well thank you so much, Barbara.
Absolutely.
We appreciate you walking us through that, and now we're here with Mark, the endoscopy technician, and we're going to talk to Mark a little bit.
Wonderful, thank you.
So we're here with Mark Thomas. Mark is an endoscopy technician in the endoscopy suite at Coastal Carolina Hospital. Thanks for joining us today, Mark.
Thank you, ma'am.
Tell us a little bit about your experience, how long you've been here, and a little bit about what you do.
Sure. So as I said, my name is Mark Thomas. I came from New York. I came down here about 2 years ago from Binghamton, New York. Worked in the facilities up there, 43 years in the medical service, 14 of that being in the United States Navy as a Navy hospital corpsman, and also working in the field of emergency medicine. Coming down here, I selected Coastal Carolina as one of the hospitals of choice to come to work for through Tenet. I've heard a lot about it, and it was a great experience. It's been a great time here in the Low Country. I really enjoy it, and we're here to stay.
Wow, it sounds like that you're well trained then. You have a lot of experience
Yes,
in
ma'am.
this area. Okay, well tell us a little bit, when people come in for this type of procedure, they're a little bit nervous. Tell me what you're doing with the patient when they roll in.
When the patient comes to the endoscopy suite, their anxiety levels are up regardless of having the medication, prior to having the medication or the sedation. Our biggest thing is to make sure we ask the patient the questions. Is there anything we can do for you? How do you feel? Are you warm enough? How's your pain level? Pain is a big experience thing with patients, and that's what we try to strive for, is on managing pain control. We try to keep them comfortable all the time and communicate with them prior to them being sedated for the procedure. As Dr. Russell did explain, sometimes they will forget what they had before they came in, And so we carry away, hopefully they'll remember that we asked them those questions, and it will be a welcoming experience to come back to Coastal Carolina for further care.
So both getting ready for it, and at the end, you want people to remember more that personal touch that they got rather than what they went through to get here.
Yes, ma'am. Yes, ma'am.
Good, good. Well, you know, I think that having someone of your experience is something that would make people have confidence in you, you know, and the place that they've come to. So during the procedure, in addition to giving that warm touch, are you actually helping the doctor to like position the patient and just, you know, communicating throughout with the doctor?
We are. When this procedure starts, we are usually in the back handling the scopes, as you see illustrated here. We have all of our equipment off to the side of the scope. As the physician or the provider starts to do the procedure, there are times that they'll request us to do certain things, such as position the patient, such as push on the abdomen so they can get a better positioning of the scope. The other thing we do is we will stand back once they've entered the scope into the rectum and they start the procedure. We watch the screen, which is illustrated here in back of us, as Dr. Russell explained to you. So the doctor will be doing the procedure. Once they start the procedure, if they do come across a polyp or an abnormality, what they will do is they will request to have a biopsy done. Our job entailed to that is we have certain equipment that we use to retrieve the polyp, and then we process the specimen once it's taken out.
Okay, so all very technical with a warm touch.
Yes, ma'am.
Well, thank you so much, and we appreciate you joining us for the Healthy Living Show, and we hope that we've encouraged you today to get screened because it's very important for your health. See you next week.